Hello, Dr. Robin here, and today I want to talk to you about fiber. Fiber has so many health benefits. Some of the obvious ones that we know, that fiber helps us poop, so it helps us be regular. Fiber helps tremendously with blood sugar regulation, so anyone with dysglycemia, prediabetes, or diabetes. Fiber is also fabulous to help with cholesterol levels. I know a lot of people are concerned with that, kind of helping with the ratios as well. And fiber actually has also been shown to help with weight loss and to help prevent cancer. So a lot of health benefits of fiber. The question is, how much fiber do we need, and how do we know if we're getting in enough fiber? So the RDA recommendation for women is at least 28 grams, and for men is for women is 25, and for men is 38 grams. With that, the best way to know if you're getting enough fiber, I would say, is to track a few days and see where you're at. A free app that's out there is MyFitnessPal. You just get on your phone, download, log everything that you eat in a day, and then in the summary it will show you how many grams of fiber you have consumed. So of course, ideal is to get fiber from your food, but with some specific conditions you might need fiber supplementation. So I want to talk a little bit about that. But first, there is one question: is there anybody that should not have additional fiber? So some things that are great for one person can be another man's poison. For me, anytime anyone are having gut symptoms or any diagnosis, IBS, IBD, Crohn's disease, or whatnot, the first go-to is to do a stool test. I've got what's called the GI Map stool test, just a test kit that I ship to you if you're not around here, or give it to you if you're here. And you collect a stool sample, ship it in, and they give us back the results. With that, there's a lot you can see looking into the gut. If anybody has a candida infection, that can feed off of the fibers, and so we do need to take them out for a little time. Or if anybody has SIBO, which stands for small intestinal bacterial overgrowth, then that can feed off of the fibers as well. So some people, if you eat certain foods and you notice you're feeling bloated or look like you're 3 months pregnant, that might be a sign that you don't need it. But when we do the stool test, I often find on a lot of people that we have dysbiosis with deficiency or low bacteria, and we look at the bacteria phyla and it's lab low. That's where we need fiber. A lot of these fibers are also what we call prebiotics, which mean they feed the good bacteria, they feed the microbiome and balance our microbiome. So I really like that. Anytime I see low, I often will go to fibers depending on what I find on their gut. We've got sun fiber, which is a great soluble, invisible fiber. Looking at that, so your body can just digest it and you have no taste, no grit, or anything issues with taking it, and it's not pill form. And then also we've got Fiber Mend, which combines sun fiber with other fibers to help as a prebiotic to heal the gut. And then in the stool test, also is a test called zonulin for leaky gut or intestinal hyperpermeability. If I see that on people, I will go through a gut healing protocol and always include in there the microbiome's mega prebiotic as well, which is another prebiotic fiber. So those are some of our fibers. You will use fibers though with people that are diabetic or pre-diabetes to balance those blood sugar levels. So with that, challenge you to log your food. Best way to see, of course, we know a lot of the basic foods with fibers are going to be your whole foods, your fruits, your vegetables, your nuts, your seeds, some whole grains. So check and see where you're at. For the women, try to get to at least 25, the men 35, 38, and you're all set.